Our top story this hour, the South African Human Rights Commission says they will assist the families of the deceased babies with some legal action. The babies died at the Thelle Mogoerane Hospital in Vosloorus on Gauteng's East Rand.
The Commission believes that the deaths are a violation of the right to access to healthcare. The babies had contracted Klebsiella pneumonia at the hospital, and one of the causes of the outbreak has been cited as overcrowding at the neonatal unit. The Commission conducted a site visit to the hospital this morning.
They met with the staff members and the union representatives. Hospital management was not available as the hospital does not have a permanent CEO. Staff has described the working conditions as stressful, with overcrowding and understaffing a norm. They also cited unsanitary wards. 11 babies picked up the infection, with 20 more testing positive for the strain of Klebsiella. This weekend, Health Minister Dr. announced that the neonatal unit at the hospital will be closed to decontaminate the wards.
59 babies are still in the ward today.
Good afternoon. We're here at Thelle Mogoerane Hospital in Vosloorus on Gauteng's East Rand, where since July this year, 6 babies have died from the Klebsiella outbreak. The multi-drug resistant bacteria was found here at this hospital and contaminated and infected 11 babies. On the weekend, we heard the health minister say that they will be now moving these babies to other hospitals to decontaminate and desanitize this area. The South African Human Rights Commission this afternoon visited this hospital to get an idea of the situation here. With me right now is the Human Rights Commission, Boang Jones. Good afternoon. Thank you for joining us. Your organization cited that the deaths of these babies were human rights violations and a violation of access to basic healthcare. Why did you decide that that's, what these deaths were?
Firstly, we are pained by the fatalities at this hospital. It is something that should have been avoided. It's something that could have been prevented had the hospital management heeded the call from the organized labor and hospital staff, who sent information to management to take appropriate and measures to curb any incidents that could lead to cross-contamination, to infection, and all of that. We've heard from the hospital staff today and from the people that we've interviewed that there is credence to allegations that this hospital is overcrowded. Overcrowding is a safety issue, and we are concerned about patient safety. We are concerned about unsanitary conditions at this hospital. We've visited a number of hospitals in the province thus far. Compared to them, this has been the hospital that we've visited to date, and we hope that government will come up with a clear and timely and coordinated response to challenges that are plaguing this hospital.
What legal ramifications would the Commission now take?
Well, we have restated to government, to the management of hospital, that the Commission is available to provide assistance when needed. We would like to play a mediatory role because we are worried about the financial health of the Department of Health. So they may face civil action as a result of the fatalities that occurred at this hospital. So we want to play a mediator role between the deceased babies' families and the hospital to find an amicable settlement before this can go to court. We also want government to provide the Commission with a clear time-bound action plan, because the incidents that have happened here, the concerns that have been raised, implicate a number of rights in the Constitution: the right of access to health care, right to human dignity, and other socio-economic rights. We are worried that government is abdicating its responsibility to respect, to promote, to protect, and fulfill the rights in the Bill of Rights.
Thank you so much. That was Boang Jones from the Human Rights Commission telling us about what legal ramifications they as a commission will be taking against the Gauteng Health Department on the deaths of these 6 children that were infected with Klebsiella here at the hospital. We also heard that the number of deaths was contradicted. We've heard nursing union DENOSA saying that the numbers are far more than just the 6. And to speak more on that is the provincial organizer for DENOSA, Bongani. Thank you so much for joining us. Your organization has been saying that it's not just 6 babies that have died. The numbers are far more. Can you explain to us how much of the numbers that you and your organization are citing, and why do you all state that?
Look, remember when we started this issue in May to start to engage the management, already nurses in the unit were complaining that there are deaths, and the manner in which the babies are dying, it is unusual. Something should be wrong, and we started reporting. And from that point on, only the first case was picked up in July, the 1st of July. But between May and June, nothing was done and nothing has been picked up. And from that point in time and currently, when we then went back to the deaths, as nurses were reporting to us that we are concerned in this unit, something is not right. Far more than that also is the overcrowding and the area that is unworkable. And then we went back after we've then engaged, we've managed to get the attention of the HOD to say, these are the numbers we have. And the numbers we have is 24, which we have names and file numbers. But because we know of cases that were reported prior, we then said we want to go back to those cases so that we can relook at those cases. Funny enough, when we go to the system, that has been deleted. We go where the records are being stored, files are missing. So the question is, who has made sure that this data that is important disappears? One, only the CEO is being put on special leave. We were complaining about the inability and ineffectiveness of the nursing service manager. She is still here. Isn't she complicit into the missing data? That's a question that must be asked. The acting CFO, also, because those are the people that were making a whole lot of problems. Also the acting human resource manager. So are they not complicit in the data that is missing? So we believe that it's far more than 6. They might have picked up 6 because those were the information that were given to them. Remember that they did not go through the entire data as of May and currently. They were given the cases that they've managed to do. So the question is how far they have went in terms of finding out how many babies have passed on due to this outbreak.
So are you as DENOSA saying that this incident did not just start, or the outbreak didn't start in July, but it started right then in May?
Definitely. That's when we wanted the attention of the management to say that there are problems in Ward 2. Nurses are complaining. The area is unworkable and babies are not safe. And nobody wanted to listen. People decided to be, to not want to engage, be arrogant, and dismissing all what the labor was saying. And that was a problem from the onset. And only in May, when they started to pick up the cases, then they still failed. Remember that once there is an outbreak, you report to quality assurance to come and do investigation. I can tell you now that quality assurance at the head office, they don't have a report regarding the unit. Why they fail to follow processes? What is it that they are hiding?
One of the issues that comes up throughout this investigation and hearing about it is the overcrowding at not just the neonatal, but in all the different wards, but specifically with neonatal where the fatalities occurred. The MEC as well as the minister told us on Sunday that there was 90 patients in a 69-bed ward. How does it affect nursing staff who are there on the floor?
Trust me, it's worse. I think those nurses can't cope. Let me give you just a simple stats. Actually, it's 61, not 69. That ward is covered by 4 shifts. And per shift, you have 4 nurses working. And only 3 nurses can do serious life-saving duties in that particular unit. So that means each nurse has to look about 30 patients at once. Is that possible in a space of 12 hours? When we have to include the issues of lunch, tea time, that means they don't rest. They are working like machines. At some point, they are going to break down, they'll be fatigued, and more of compromising patients. They will compromise patients more and more because they cannot effectively function in their units. So it's worse, it's terrible. And the issue of not paying attention also into shortage of staff, it shows that there is a lack of management or effectiveness in managing human resource. That means basically we have non-managers. We just have people that are appointed to get salaries, and loot the taxes of our people in the country.
Thank you so much. That was Bongani from Denosa speaking to us on the challenges that the nurses face here at the specific hospital where we saw the outbreak of Klebsiella. According to Denosa, the outbreak did not start in July as stated by the Gauteng Health Department as well as the ministry, but as far back as May. Back to you in studio.